Today let us see about the biomedical waste management. Under this biomedical waste management, let us discuss definition, source, types, effects and steps of management of the biomedical waste, segregation and treatment. Now the first one is definition. What is the definition of the biomedical waste? Means the waste that produces during diagnosis. The waste that produces during diagnosis, during treatment, during immunization and during research process. The waste that produces during diagnosis, treatment and immunization and research is called as biomedical waste. Biomedical waste means, the definition of the biomedical waste is the waste that produces during diagnosis, during treatment and during immunization and during research is called as biomedical waste. Definition. And now next, sources. In the definition itself we can see the sources. What do you mean by sources? Exactly from where this biomedical waste is coming from. While during the diagnostic process we can produce the biomedical waste, and during treatment the medicines, the empty boxes are radioactive medications, such type all comes under the biomedical waste. And immunization, the cotton we use to we use to clean the area, and injections we use to inject the medicine, the remaining immunization or immune medicine, these all the things comes under the biomedical waste only. And research, during the process of research also the biomedical waste gets produced, even the laboratories, in the hospitals. And if you want in detail, what are the sources of biomedical waste? Hospitals, labs, research centers and immunization centers. During this all the processes, actually immunization during the hospital treatment. For example, the hospital, they are giving the care to the patient. During care process of the patient, there is a lot of biomedical waste produces. For example, patient passed the motion on the bed. That also comes under the waste, right? And patient blood is we took for the laboratory test. Whatever the blood is there after have done of the laboratory test, for example CBC, complete blood count. After doing it, what they will do with that blood? They'll have to throw it by segregating in a different container. They'll have to throw it carefully after disinfecting. Right? So, and research centers. What do you mean by research? On the animals, on the human dead bodies. They do some research process to find out new things in the medical sector. So during that time also waste produces, that also called as biomedical waste. Even immunization center, I already explained you, remaining like vaccines and cartons, used cartons and blood, all these comes under biomedical waste. These are the four main sources of biomedical waste. Okay, now let us see the types of biomedical waste. There are mainly two types of biomedical waste. The first one is hazardous, second one is non-hazardous. Non-hazardous again divided into, like under that non-hazardous, general waste comes and pharmaceutical waste comes. General waste, what all the general waste? Paper, food and household waste. Paper, food and household waste comes under the general waste. And pharmaceutical wastes are like, the pharmaceutical wastes are like the drugs and all the medications. And hazardous and non-hazardous. What do you mean by the hazardous? It harms the human's health or the environmental health. Hazardous. Non-hazardous means it doesn't cause any harm. Okay, hazardous. And Again, subcategories are infectious and toxic. Infectious, all the pathological waste. The pathological waste is nothing but the tissue, body parts, human body parts, animal body parts, tissues, all these things comes under the pathological waste. For example of pathological waste is somebody's, we have operated somebody's body part, like on the body part we have removed, amputated means that particular body part is not working or crushed worstly. Because of the accident, that body part got crushed. Can that body part work again? No. Can we keep that body part in that person? No. Because it causes further infection to the other body parts. So we will just cut off that particular body part. That body part comes under pathological waste. Next one, laboratories. All the remaining body fluids, laboratory waste, bloods, urine, then specimens, cultures, all this comes under the laboratory waste. Blood banks. After collecting blood banks, what are the things that comes under the blood banks? Platelets. Okay, all the like blood, all the blood contents, FFPs. Means like frozen platelets, frozen, many categories are there, the types of the blood components. All these blood components are kept in the blood bank. They can keep these components only just for a while, right? They cannot keep for many years. Only few months only they'll have to keep. After few months, if they get expired, if they are not used, what they'll have to do? They have to throw it, right? These all the things comes under the biomedical waste. And comes to the toxic. Toxic means poisonous or dangerous, hazardous waste. What are the hazardous? Genotoxic. Geno. What do you mean by gene? DNA or RNA. The genetical code. Genotoxic. Why they call the genotoxic means these wastes, some of the wastes, they are very dangerous. If we unfortunately expose it to the genotoxic drugs, there is a chance of genetic mutation. What do you mean by genetic mutation? The sudden change in the genetical information. The sudden change in the genetical information is called as mutation. Right? So when we expose it in this, there may be a chances of breakdown of this chain and causes the cancer. They are carcinogenic. Carcinogenic means the drugs that produces cancer is called as carcinogenic. Carcinogenic. And radioactive, active medicines. Radioactives. What are the radioactives? For example, one person is having cancer and the doctors treat that person with a radiation. And some of the things that are attached to the patient are we just left there in the ward. Somebody comes and touches it, or somebody comes and exposes to it. See, after exposing to the radiation therapy, the patient, from the patient also some radiation rays comes out. Do you know that? Do you know that after a patient is exposed to the radiation therapy, for a while, for few hours, from that same patient, the radiation rays comes out from the patient. And whatever the equipments, instruments are with the patient, that material also can produces radiation rays. If we expose it to that radiation rays, our genetical information changes. Why we are giving radiation? To kill the excessive growth of the tissue, cancer tissue, right? So the same thing, these radiations can cause in a healthy person, kills the normal DNA information and causes the genetical mutation. This is the reason, that is the reason these called as hazardous drugs, hazardous biomedical waste. Hazardous biomedical waste. We'll have to throw these medications very carefully and handle these medications and these such type of waste very carefully. That is the reason it is very important to separate. Segregation is nothing but separation of biomedical waste is very much important to avoid further infections and disease conditions to the healthcare workers and patients. Right? Infectious means, the name itself it is saying that the infectious material present. What are the infectious materials? Microorganisms, either fungus, bacteria, virus. These all the things are present in the infectious waste. In the name itself it is there, infectious, that can cause infection to the person. That comes under this infectious pathological laboratory and blood bank products comes under. See the effects of biomedical waste. How can it affect if in case if we fail to segregate and if we fail to treat in a proper way the biomedical waste? If you did not segregate and if you did not dispose them in their proper way, what happens? Air pollution. Because pathogenic organisms or infectious organisms are there on the material, that may spread into the air and causes air pollution. And water pollution, if you throw without segregation wherever we want, that it causes water pollution in the rainy seasons. This infectious material goes and falls in the water. That kills the fishes, all the lively stocks in the water. Not only that, the same water we do drink and fall into the sickness. And land pollution, even land pollution also takes place. Right, if we throw in a land, that land also gets polluted. Right, these three effects caused by this biomedical waste if we do not dispose them in a proper way. Next one is steps of biomedical waste management. What are the steps that we have to follow to proper disposal of biomedical waste? First one, the survey of the biomedical waste. They do survey where all the biomedical waste is producing. What all the labs are there? How many hospitals are there in a particular place, and how many labs are there? How many blood banks are there in a particular area? After that one, they categorize it. Categorization is nothing but how much is general waste and how much is hazardous waste and non-hazardous waste. Categorization. After categorization, they segregate. However, the segregation is taken place in the hospital itself. The segregation is nothing but separation of infectious waste and non-infectious waste. For example, what is the segregation? Plastic waste goes to the red bin, anatomical waste goes to the yellow bin. In that way, they do segregate the waste, separation of the waste according to the color code. After that, storage. In a particular area, there is a storage place. For example, in a hospital, there is a central storage place for the departmental storage place for the waste. Not more than 2 days. They are not supposed to wait for 2 days. So only they can wait for 48 hours. Within that 48 hours, they'll have to transport that waste to the central department, where they can treat the biomedical waste. You will be wondering that what do you mean by treating of the biomedical waste? Treating of the biomedical waste is nothing but general waste. General waste will be like incineration or land dumping. They'll dig a pit in the land and dispose all the waste which are related to the land dumping. For example, tissues, laboratory waste, all this goes under the landfilling. Incineration, all the infectious and non-solid waste are like solid waste comes under the incineration. Body parts, they may burn also, right? Or some lab materials. They may burn, like infectious, very contagious catheters. So they can burn, right? Or otherwise they may disinfect and reuse it. I will just discuss you this one later, which material goes for the which treatment. Why? Right? Now, for now, steps of the biomedical waste management are: first one, survey; next, categorization, segregation and storage, transportation and treatment. These are the steps of biomedical waste management. Next is segregation of biomedical waste. Segregation of biomedical waste is nothing but separation of biomedical waste depending upon the category of the waste. Depending upon the category of, we do separate the waste in a different colors. That is called as segregation of biomedical waste. The first one is black. Black color, in the black bin, we throw all the cytotoxic drugs or toxic drugs. What are the toxic drugs? Radioactive medications or the oral anti-cancerous drugs. All these comes under the black dustbin. So this remaining biomedical waste goes for the treatment is landfilling. Treatment is landfilling. Next one is green. Green bin, all the general waste. The general waste are like paper, food. Next, all the household waste comes under the general waste. This general waste goes for the landfilling and incineration. Papers goes for the incineration, and food products and all goes for the landfilling. And yellow. Yellow is all the anatomical waste. Anatomical wastes are like body tissue, and next like any body parts. Pathological waste, body tissue, body parts, pathological waste goes into yellow dustbin. This treatment is incineration and landfilling. Incineration and landfilling. Incineration is nothing but burning. Landfilling is nothing but they dig a pit in a far away places and dump all these pathological waste and fill it. So even for example, the weird masks and caps, or else used masks and caps also goes to the yellow bin. Why? They are attached to the human bodies, right? Sweat. They are exposing to the sweat and respiratory fluids. Obviously, they go into the yellow dustbin. And red dustbin, all the plastic items. All the plastic items are Foley's catheter, Riles tube, suction cannula, and all these plastic items and IV fluids, IV cannulas, IV catheters. This all goes into the red dustbin. Why they have to go to the red dustbin? They either incinerate or recycle. They reprocess it. The plastic items, they reprocess it. Because if we fill in the land dumping, the degeneration of these plastic items takes years together and causes the greenhouse effect. To avoid that one, either they incinerate it or recycle it. Next one is blue. All the broken glasses, ampules goes to the blue dustbin. Blue dustbin. This all goes for the sterilization. Again, recycling. They will sterile it and they recycle it and make it again glass items. White. White puncture proof container. This one also called as puncture. Puncture proof container, because all the needles, blades, scalpels, next all the IV cannulas needles goes into this white puncture proof container. They incinerate it or landfill it. The treatment is incinerate it or landfill it. These all the mainly, how many types are there? 1, 2, 3, 4, 5, 6. 6 types of segregations is present in the hospital setup. The first one is black, all the cytotoxic drugs goes into the black. Green, general waste. Yellow, anatomical waste.